Okay, without further ado, I'm going to turn it over to our first presenter, otherwise known as Uncle Steve, Steve Pettee, Administrator for Pacific Group Agencies. He oversees all of the benefit plans and administers them on behalf of RESDC. And he's going to take you through a little presentation and overview of what they offer. And once again, at the end, I will gather all the questions and ask Steve questions for you. So at that point, Steve, it's all yours. And then you want to try to share the screen, let me know if it works out and we'll figure it out.
Let's see here. Okay, so I go share. I think that's, is that, let me see. Can you see the screen then?
Yep.
Okay, good.
I'm going to stop Jerry and Stan's video just real quick.
Okay, thank you much. I had a couple notes that starts here, and I'd like to thank everybody for their time today for this presentation. We're always happy to present the plans over many years, and this being a very difficult year from a standpoint of the health concerns that all are very much concerned with as well. What I did is I came into our office, I took off my mask. I guess I don't need this. I am now a Zoomie, I think. I don't know what everybody's called these days, but this is a situation that we're able to do for you, and we're glad of that. So what I'd like to do now is just tell you about the RESDC benefits. As many may know, that this is a plan offered exclusively to RESDC members. And if you are a member, you are eligible to join these programs. These are group rated. They are very competitive. They are a very customized design, so that it's the benefits that seniors most have asked for. At that point, I can go on to the next slide and just tell you a little bit more. Let's see here. I go arrow down.
Space bar.
Oh, space bar it is. That space bar did not work.
Try your arrow.
I did my arrow back, forward, up. That is really weird. Okay, let me see if I can't believe this. This is crazy. This is how it starts. But
how about just hitting enter or trying to go to the bottom of the screen and should be 4 arrow keys: left, right, up, down. Try the right arrow key.
4 arrow keys
on the bottom of your keyboard.
Okay, I'm looking at my keyboard. I'm hitting those up and down arrows, but that did not happen.
Don't do up and down. Do left and right.
Left, and right. They did
Strange.
not have, yeah. Let me stop and start it again if that's a.
Yeah, that's fine. Go ahead and stop sharing and then restart. Try that.
And then let me go. Let's go screen share, and then I'm going to go to this one. Okay, and then I go big, and then I go, let me arrow right. Okay.
There you go.
I can't explain that one, but sorry about it. As I mentioned, it's offered to all. That's members of RESDC, their spouses, and also eligible dependents. On the dental and vision, this is there's a couple times where your benefits are available to you to join. This is when you have what they call a qualifying event. Hopefully there's no break in service so that there is no applicable waiting periods. But if you come on within 60 days of your retirement date and or from ending COBRA, you can come on to these plans with full benefits on it. You can also enroll at the open enrollment time, which, as you know, is right now, and it goes through November 13th. That's when the cutoff is, and hopefully we could have your enrollments. And don't send anything, if you don't mind, send anything back to us unless you are making changes or you're enrolling for something, because the benefit plans continue and they self-renew unless we have otherwise from you in writing for changes or any other changes you might want. If you're electing spouse coverage, you both have to be on the same plan, is the point. Then the ancillary plans, you can enroll at any time. In other words, if you're going to take trip insurance, if you're taking a trip wherever, that you don't have to wait to open enrollment on that. It's just when you are going to make a trip plan and you need insurance coverage. As an example, you can use these, you can enroll at any time. Let me just go to the next slide here. As I mentioned, November 13th is definitely the cutoff for that. I always put this out front that if you have any questions that you need clarifications on, well, just give us a call at this toll-free number. We also have the the email that you can send it to. And if you wouldn't call, RESDC or SDCERA or Mercer or San Diego County, because they can't help you, these plans are administered by Pacific Group agencies. And we do this same service for probably 18 out of the 20 1937 Act counties currently. So they're very, very popular, if you see what I mean. And there's questions, how do I, if you have coverage, on other county plans, do you have to do anything? These do not have anything to do with those other enrollment plans. If you wish to cancel a county plan, you just need to contact them directly for that. Let me go on to the next slide. And this is the what we call the benefits that are applicable for this open enrollment. It's the dental, the vision, because you have to come on during open enrollment. Those are the two main ones that apply the open enrollment. The legal shield, the ID shield, we'll speak to those plans in just a second, and also personal accident. These are plans that do require an application to be submitted. You can always mail it in. There's an envelope included in your benefit guide. They should be received or soon to be received by the prospective and current members of RESDC. And if you don't have an envelope, I just put this in there. This is our mailing address that you can send it off to if you could do that. The other ancillary plans that you can enroll with, and you can just give us a call by phone or actually contact the carriers directly. In the benefit guide that you've received, you'll see the phone numbers and websites, and they just ask specific questions regarding your selections. Like your pet insurance, the type of pet, how old the pet is. It's pretty much a straightforward underwriting program, and you just have to let them know that you're a member of RESDC. And with that, they apply their discounts and things like that to make your plan eligible for, for those services. Let me go on to the next slide. The dental plan considerations, there's two basic plans. They're very generically different. The PPO plan applies a network, and it's pretty much a negotiated fee schedule with dentists that are participating in the preferred provider organization. That's what PPO is short for. It's very aggressive as far as the discounts applied to services. It is the largest PPO dental plan in the nation. It's local, California-wise, and it also travels well if you're out traveling, where HMO, sometimes you only get emergency care, and then you might have a toothache or things like you might have to have done on a vacation. This could be a PPO would be better suited for people that travel a lot in that instance. But you still have HMO coverage as you travel, but it's emergency coverages only at that point. The coverage levels are always explained in deductibles and copays. I think people are familiar with that. There's annual deductibles for the PPO, and also copayments and coinsurances actually should be in there as well. But I'll speak to that in a second. The other considerations is how much out-of-pocket cost am I going to have if I use the plan in network and out of network. So the plan exclusions, I always put this in here because some of the biggest issues that we have, as far as, using the plan properly, is you're going to get 3 cleanings a year for both plans. That's the PPO and the HMO this year. However, the crown replacements can be an issue. It's every 10 years with the Ameritas PPO and Cigna. That HMO for a crown replacement is every 5 years. So we always ask people to take that into consideration when you're choosing your plan. That way there's, no mistakes on the front end, and that you're aware what the plans will pay. And if you're eligible, they'll definitely be covered. The other point that I always like to point out, and that's why I bolded it, it's that missing tooth clause. The reason I say that is sometimes people, don't, they have quite a few, they could have quite a few teeth missing. And I've had it happen where, can I have, 5 crowns or, and 5 implants and all that kind of thing. But if it's a missing tooth, and this is a very important point, if that is the case, those coverages are not extended to missing teeth, I should say, tooth or teeth. So that is what that works out to be. And then those are the considerations I always like to highlight. The next slide I have was, as I said earlier, you can visit any dentist. It goes everything from cleanings to crowns to implants. There's no network restrictions. There is incentives, though, when you do use in-network dentist, because your actual out-of-pocket is going to be lower because you're getting your percentages based on the negotiated dentist charges. That's in-network and out-of-network. So what I'm saying is if you have 25 to 40% off the street rate, like if you went in for a crown, as an example, $1,000 as an example, excuse me, crown, the cost could be more like in the area of like 60% is what the negotiated discount with the Ameritas network would provide. Significantly lower out-of-pocket costs because your percentage is based on that negotiated lower cost for those PPO dentists. It is, as I mentioned earlier, the largest network in the U.S. As far as network providers for the PPO. The next point is that you have benefit maximums. It's pretty robust. 2,500 is pretty decent as far as coverage goes annually for the covered members and covered dependents. Excuse me. And then the out of network is 1,500 per year. That's the calendar year benefit maximum is how that works. Let's see what else I've got for you. There's another benefit in this plan that also gives you what they call a annual benefit dental reward. If you use less than $750 of your annual benefit, you will get a $400 banked amounts that you can use in the following year towards your benefit maximum. So as an example, if you had a $2,500 annual maximum in network, you would add 400 to that next year. So 2022 would be $2,900 would be your maximum for in-network services, for the benefit. The other, and of course, the 250 is if you went out of network, would be your reward for that following year to add it to your max. The other benefit I had there is the enrollees when you visit a dentist, like at least once a year, and the whole purpose of dentistry, I believe, is you take care of them because the toothaches don't go away, they get worse, and they cost us a lot of money. I think it was a very good point that the board and the officers of RESDC had put in a third cleaning. It has proved to be very, very good. Even though it's extra cost, it's also helping people take better care of their teeth, so their dental issues don't get more expensive. And it's been quite a good feedback on that as well. Let me see here. It's, as I said, it travels well and it's available anywhere in the U.S. Let's go here to the dental. As I mentioned, or I may have mentioned, these are all in your benefit book, but I just like to highlight these things. It's a $50 per person per calendar year, and that's in network, but $75 per person per calendar year for out of network. And then as you see, it's it's way for preventive. So you get 100% in network and 80% out of network. So they're heavily incentivizing the use of the discounted plans because that lowers the cost of claims and obviously controls your premium cost down in the future. This is very extensive. It goes, as I mentioned, everything from cleanings to the oral exams, all your bite wing exams are all included under the preventive services. Your basic services, as I was noting for you, is these services are covered. The periodontal maintenance, the fillings that you're going to have, your simple extractions, all your X-rays, your repairs, emergency pain relief. Your first year under the plan is 80%. So it's 80/20. And then it's 85% in the second year, and then it's all the way up to 90% over time. 90% will be your basic services, and that, of course, is versus just a straight 80% for out-of-network. And for those who use out-of-network providers. Major services, as you may know, is 50/50. That means 50 is the plan benefit, and then 50% is your cost out of pocket. I always like to try to put this out front. There is a 12-month waiting period if you did not have coverage during the year 2020. That's a full year. It does apply a 12-month waiting period, but that's just for major dental services. So if you haven't had dental for a year and you come on this plan, you would have preventative and minor restorative care provided to you, but you would have to wait 12 months waiting period from that time before you would, have your crowns, your implants, all your endodontic work, root canals. I mean, this is very, very elaborate as far as the coverages go. And this is in your benefit booklet, so I'm just going to go on to the next slide. But I'm just highlighting these points for you. And obviously, I look forward to answering any questions you may have. The Cigna HMO, dental HMO is, you have to use a network dentist. I think most people are aware that HMOs are very specific. You must select a dentist, at least on a monthly basis. You can do that by calling in or going online with them or calling our office if you decide you want to try a different dentist or your dentist retires and you need to select another one. They can give you the facts and figures on which dentists that are available under the program. It's pretty elaborate. It is a zero copay plan. This is probably the best plan that Cigna has to date to offer members like yourselves. And there's 380 services that are considered covered under the plan. The zero copay applies all the way along the way. And then it's obviously it's popular because it is so comprehensive for the cost, and also it has the zero copays for the covered services. And again, it is not just a California plan. It is in most regions nationally. We have some people that, might have two homes or vacation 6 months out of the year in some other place. They can switch under the HMO. You can switch to a provider that's close to your vacation or second home if that's the case. Let me go on to, I don't know what happened there. Geez. Okay, I touched something. Let's see here. I'm trying to, I don't know what I touched. Okay.
Steve, do you have access to, hit escape.
Okay, so I'll do the escape key. Okay, sorry about that. I don't know. Anyway. I have trouble. Okay, let me go on. Let's see here, dental. And then I was talking about that, and I think this is all good. They extend discounts to you. This was the big thing with Cigna. It's a very comprehensive program. It definitely limits your calendar year cost because it does not set a calendar max like the PPOs do. There is no waiting period. These are some of the other things that are definitely features to the plan. Whether it's cleanings or crowns, it's covered under the program, and you'll get a full list of in your certificate of insurance that's provided to you after enrollment. It's sent to you, and this is why you'll know what you have under the program, and you can analyze your cost as you sign up for your services through your dentist. Let's see here. And I always put that on there. Always ask that last point down there. It's dental predetermination of benefits. I always ask people to do this. Ask for your treatment plan and the service that are rendered so that you can confirm your bottom line out of pocket. Sometimes there's misunderstanding where there could be maybe there's sometimes there's antibiotics that they use that might be, I think I had one that was like $175 for, that, and that was not covered. And this was something I asked the dentist about, and they removed the cost for me. But that's because I knew the treatment plan on the front end before I had the services done. I happen to be on not as good a plan as yours, but it's definitely that's a Cigna dental HMO plan. Next slide then is the vision. We have two vision plans. The first plan is with exams. This is a VSP. I think vision service plans everybody may be very familiar with. It's one of the biggest and best I would consider. And if you need to find, a VSP, a choice network provider, it's very easy. They have their web link to look into your particular zip code and can come up with a provider in your area. All the providers offer exams and materials under this program. Let's see here. They're vital. Well, everybody knows how valuable exams are because they can obviously alert you to problems that might be in your general health that you might not know unless you see it through your eyes in your exam. And obviously good vision is a quality of life issue. And I think everybody is, and that's 20 minutes. I can't believe that. Okay, well, okay, let me just take a few more minutes to wrap up here. This was the exam, with exam coverages that are listed out for you. This is in the benefit guide, so I'm not going to go through that too much. There also is a Vision 2 plan. This is just pretty much the same.
Hey, Steve.
Yes.
You got a little extra time. We only have one question thus far.
Okay, good deal. Okay, let me just finish out with this. But this is all in your benefit guide. And I'm going to go on to the next one. The extras, all the discounts are built into VSP's plan. This is a very good thing for you because, you scratch resistant. I have people paying $600+ for their glasses, and you want to take care of those glasses. And a lot of these discounts are applied through the plan, and it's fairly significant as well. Let me go on to this. Legal Shield, this is a plan. I'm going to just leave this just to let you know because it's too wordy, but it does cover a whole lot of things, that are in your program. Your legal documents, protect you if you ever get sued. I mean, I've used them several times, just because, it's always good to know what you're signing from a lawyer standpoint. And so that's the point on that. ID Shield Protection is another very, very important program that's, hasn't been looked at with a lot of people for a long time, but now it's becoming very mainstream. So if you need an ID Shield plan that will actually fix your damaged, if you are breached, your credit report, and a lot of people could really benefit from that because that impacts everything that you try to do these days with having a good credit report. Then personal accident, this is, by the way, is our most popular plan. It also has a secure travel a rider to it that would bring you home if you should pass away, if you should be in an accident, if you should have a medical emergency. All these benefits are called medical transport, and you're brought home, with these plans. So that's a very good plan, and it also has quite high accidental benefit life amounts and accidental coverages available to you as well. Travel Guard, this is real quick. Not too many people are traveling these days for that simple reason. It's the COVID thing, I believe, and unfortunately, but it's still out there. It's still being used. This is the information required for your Travel Guard. Just real quick summary. These are the plans. They're in your travel or in your benefit guide booklet. We do life insurance. I can't believe how many life insurance quotes have come in over this last 3 months. But we have been very aggressive on it and doing very well. I didn't mention anything about pet care, but if you have a pet, give us a call and we can get it insured for you. A little Fluffy falls off the couch and breaks that forepaw, it's going to be very expensive, and these plans can really mitigate that cost for you. So let me go on. Oh, that's my last one. Contacts for further information. Thank you for your kind attention. And thank you to the board and the officers and SDCERA. And if I didn't forget anybody else, I'm here. Just give me a call. I'm Steve, AKA Uncle Steve. My nephew forgot to change that. And he handles our Zoom account. I apologize for that. And that's all I can.
Steve, can you leave that slide up while we go through the questions?
Leave that slide up. Okay. I don't know why it went off. You are sharing your screen. I don't know where it went.
Try to bring your slideshow back up. You're already sharing the screen, so try to.
Okay, new share. That last. I hate to throw my hands up on this, but I'm telling you,
try hitting the back button, the arrow, back arrow.
Back arrow.
There you go.
This computer's, I don't know. It's like,
hit it again. Hit it again, Steve. Hit the back arrow again. There you go. Now stand 10 feet from the keyboard.
Now back away. Thank you all very much. I really enjoyed the relationship we've had for many years with the RESDC folks, and and go Dodgers.
Hey, well, the
I had to throw that in.
The feeling is mutual, Steve. Thank you very much for a great presentation. I'm going to ask the one question, but if anybody wants to send me a quick question, oh, here's somebody else. Oh no, that's not a question. Remember to go into the chat button, bottom of your screen, click on that. It'll open a window. You can go down to the bottom of that little small window and you can send a message or a question directly to RESDC. Just click the drop down. All right, Steve, here we go. How do you determine which dental plan is better, HMO versus PPO, and which plan to go to, and the plans including Cigna, HMO, PPO, Ameritas, Delta, you can't really speak to because that's an SDCERA plan, but Jerry can probably speak to that.
Yes, absolutely. Thank you very much for that question. That's probably the number one question I get. Obviously today it is, but it's, I always say it's akin to beauty is in the eye of the beholder. And I've always said, if you love your dentist and you don't want to change, and a lot of folks have been with the same dentist as an active employee, when they retire, they want to keep that dentist. Then a lot of times an HMO might only cover 10% as a network of dentists that are out. That are available to you, but a PPO is much greater and it's not required. So you can join the PPO plan if you want to keep your dentist. I think that's the number one answer to you, is if your dentist is everything. That's one thing. We have had situations where my dentist actually retired and I had to switch because not that I had to, but it was time, and I went from the PPO to the HMO, and that was an indicator, and that happened to me. And I've had that come up with several folks that are on the programs currently, that they've had that situation arise. So the plan kind of morphs with you. If you need to change, you can change. The HMO can do that, but as I mentioned earlier, only 10% of the dentists are networked in that, and it is required that you sign up for that whatever dental group that you are going to choose, at least on a monthly basis. And you can change that, but it's always the next month after for the effectiveness of the change. But I think that was the difference with the PPO versus the HMO. The other point on the HMO side is that it's cost effective. That's one of the reasons I took it, because I had to have some things done, and it was very cost effective from a standpoint. Co-pays, you know what you're going to pay out of pocket. You go in, and it was pretty much the same office that I had gone to. I was sitting in the waiting room with people on a PPO as I was, and right next to me are people with the HMO. So I thought it was time to make that change, and I'm glad I did. So I don't know if hopefully that answered your question.
Thank you very much, Steve. Now, can I ask a favor of you? Can you stop sharing your screen?
Stop share. Okay, I go here. Okay, bye.
I'm going to withdraw your co-host, and I'm going to ask Jerry to unmute, and I'm going to ask him to I'm going to bring his video, start his video. There's Jerry. Hey, Steve, I'm going to stop your video. Jerry Fafaul from SDCERA is now going to get co-host permission here in a second. Then he's going to bring his slides up, and he will go through his presentation. Once again, thanks to Jerry, Kahe, Kathleen from SDCERA, Jim Leary, who I saw is on this call, all of the folks at SDCERA for their support in joining this for the event. So thank you very much. And Jerry, if you want to try to, hold on. Okay. See if you can bring yours up now.
I knew it. I would sign out. It was all my computer. Let's see if I can do it here. Can you see that, Mark?
Yes.
I can.
Excellent. Excellent. Well, once again, you know, we are very appreciative that we have the opportunity to provide RESDC with some information, RESDC members with some information about the SDCERA medical and dental plans that we offer to our membership. I won't get into a lot of the detail that Steve got into with his plans, but because this information is all on the SDCERA website and in the information you might have received in the mail already for our medical and dental plan enrollment. But just to start off, we have a couple of things that are just an overview of our plans right now. So nothing has really changed in our plan coverage from this year in 2020 to 2021. We do offer the same plans, the same providers, all right? And so we do offer, again, both Medicare and non-Medicare plans for both of our beneficiaries, our retirees, beneficiaries, and their dependents. Our open enrollment is November 1st through November 20th of this year, so it's coming up next week. You should have already received information as members in the mail based on your current enrollment or not enrolled with SDCERA plans. If you do make plan coverages or change your plan coverage this year, it will be effective on January 1st. But again, there's no plan coverage changes or our provider changes for the 2021 plan year. So all of SDCERA plans have no annual or lifetime maximum limits. You pay minimal co-pays. Everything is covered through your co-pays. And we do have comparison charts on the SDCERA website with specific services provided by each of our plan providers. Let's see here. The SDCERA admin fee this year coming up in 2021 will be $5.20 per person per plan enrolled. And again, everything is effective January 1st. I'll do make a mention right now that SDCERA health insurance allowance, that's the reimbursement for our tier 1 and tier 2 members that have specific service years with SDCERA. They do get a small reimbursement, and that's available on our website. You'll be able to see that information, but we will be sending information out because the health insurance and allowance enrollment will be taking place in January this year. They will mail packets and enrollment forms to members that are eligible in December, and you'll have the opportunity to enroll and provide us the information so you can get reimbursement on your medical, dental, or prescription plans through SDCERA if you're in those specific tiers. Again, if you don't know if you're eligible, you can call either the SDCERA Health Plan Service Center, or you can call SDCERA's Member Service Center, and each of them will provide you information if you're eligible for those benefits. So I'm just going to go through some of the Medicare plan information that we have this year, starting in 2021. Again, we offer the Kaiser Permanente Senior Advantage Plan. And our Medicare plans are generally available to those who are over age 65, right? Some people do qualify outside of that age range. But again, in 2021, the monthly premium is $281.28 per month. That'd be per person enrolled. With the Kaiser Senior Advantage Plan, your Medicare benefits are assigned to the plan. And if you don't have your benefits assigned to the plan, you will pay the higher premium. It's a non-traditional Kaiser HMO benefit plan. So to enroll in an SDCERA Medicare plan, you do have to have Part A and Part B through Medicare. We ask that you get that in advance. If you are going to enroll in a Medicare plan with the SDCERA, you would about 30 days prior to your turning age 65, you would start the process. You can contact our Health Plan Service Center to get the application. You want to make sure that you have Part A and Part B effective in the month you're turning age 65, so we can get you enrolled in those plans. With Kaiser, you know, again, you're required to use the Kaiser Permanente physicians and their facilities. This is by far our most popular plan. So we have more people enrolled in the Kaiser Medicare plan than any of our retirees. We also, again, this year offer Health Net Seniority Plus as a Medicare plan, and the 2021 monthly premium is $306.83 per month per person enrolled. And you'll see that the premiums vary based on enrollments, usage, and but also with the eligibility of the plan. So for this plan, the Health Net Seniority Plus, the monthly premium is $306.83 per month, but your Medicare benefits must be assigned to that plan. And again, you're required to use the Health Net physician that you select from their list of providers. So you'd set that up in advance. And you'll see how the premiums vary and what options you have of using their plan or going outside of the network. The next plan that we have under the Medicare plan sponsored by SDCERA is the Health Net Medicare HMO. And this plan in 2021 is $690 per month. All right, so $690 per month. And the benefits are coordinated with Medicare as your primary, but you may use Medicare outside of their network, so outside of the Health Net Medicare. And you must use one of their primary care physicians from the provider list for HMO to cover your services. So because you have the option of using Medicare outside of the network, you see the premium slightly higher for this plan in 2021. So that's an option for members. Again, on all of these Medicare plans that are offered by SDCERA, you can see a comparison on our website. It shows different breakdown of services provided, what the co-pays are. And all of our plans do include prescription drug coverage. So all of our plans, including our Medicare plans, do include your prescription drug coverage for a minimal copay. Right, so when you enroll in an SDCERA sponsored Medicare plan, you just need Part A and Part B with Medicare to enroll in one of our plans. You do not need the prescription drug coverage or Part D. If you do enroll in a prescription drug plan and you're enrolled in an SDCERA Medicare plan, Medicare would disenroll you from the SDCERA plan. So you don't want to enroll in another outside plan or Part D if you have an SDCERA sponsored Medicare plan, because you would be covered fully under our plan with your prescription drug coverage. Also, we have a UHC Group Medicare Advantage plan. In 2021, the monthly premium is $304.71 per month. And this plan provides coverage in California, Arizona, and Nevada. And again, your Medicare benefits must be assigned to the plan, and you're required to use the primary care physicians you select from their list of providers. Again, this coverage is only available in California, Arizona, and Nevada, and you must be assigned their plan and use their providers when you sign up for the plan. And then we also have the United Healthcare Senior Supplemental Plan, another Medicare plan. In 2021, the monthly premium is $564.99 per month, so $564.99 per month. And this plan is available nationwide, anywhere that a facility accepts Medicare. So a nationwide plan accepts Medicare, simple, and it's all displayed on our comparison chart, and it's easy to enroll in these plans during our open enrollment. Again, open enrollment with SDCERA starts on November 1st up through November 20th. You want to get your application sent to our Health Plan Service Center, and they will get you enrolled effective January 1st. The same with any plan changes. So our non-Medicare plans, again, this year, SDCERA is going to offer the same plan providers, same plan coverage. Health Net HMO in 2021, your monthly premiums are $2,027.42 per month. Again, $2,027.42 per month. And you're required to use their primary care physicians you select from the list of their providers. So again, that's the plan we have offered this year. And we have the Kaiser Permanente non-Medicare plan, that's going to be prior to age 65. The monthly premiums next year, starting in January 1st, would be $1,049.63 per month, so $1,049.63 per month. Again, you're required to use the Kaiser facilities and physicians, and again, you would pay a higher premium, would be available if you enroll eligible Medicare. So These are our non-Medicare plans available this year. We're offering the same dental plans again this year with SDCERA. We have a Cigna and Delta plan. The Cigna Dental Care Plan, DHMO, is an HMO plan. Again, the monthly premium is $18.64 per month. The plan is available in 39 of the 50 states. So the states listed here without coverage are listed here. It's also in our packet of information on our website. You can go and find, again, a comparison of coverage services for the HMO versus the PPO plan that we offer at SDCERA. So then we have the Delta Dental PPO plan. The premium for that is $45.73 per month. This plan does provide coverage nationwide. So that's why it's a little bit more popular. Sometimes people who have different locations throughout the country, they want to have a dental plan. There are limits on this plan. So you want to go ahead and familiarize yourself with those by reviewing the comparison materials we have on our website or the materials you got in the mail, and before enrolling in these plans to make sure that you can get your coverage you're looking for. So just some contact information at SDCERA. Again, you know, the Health Plan Service Center in Des Moines, Iowa, they do, with Mercer, they do all of our medical and dental plan administration. There's their address right there. They're at a P.O. Box in Des Moines, Iowa. They have a telephone number right there. It's 866-751-0256. There's their fax numbers. Now their hours are Monday through Friday from 5:30 a.m. to 6 p.m. Pacific time. So a little bit longer for you guys here in the East and the West Coast. Again, you want to contact them first for all of your questions and concerns about the SDCERA Health Plan Service Health Plans. They should be able to provide you with all the information that you need. And then there's the SDCERA website. Has a lot of information. I'd highly encourage you to go there, look it over, check it out. It has the enrollment forms. It has plan comparison sheets. You can look at individual plans, what they would cover. And again, just to recap, all of our plans have comprehensive coverage, no lifetime limits, include minimal copays and your prescription drug coverage. SDCERA does have a passive enrollment. That means if you're enrolled currently today in an SDCERA plan and you're happy with your coverage and you don't want to make any changes, you don't have to. We will continue to keep you enrolled in that plan, both medical and dental plans, throughout the 2021 plan year. So no changes if you want to keep your current coverage. If you do want to change plan providers, your opportunity is during the open enrollment starting on November 1st. You want to get that paperwork back to the SDCERA Health Plan Service Center so we can make those changes effective January 1st, 2021. All right, and then that's all we have today. So if you have any questions, I'd be happy to answer any questions you have right now.
Thank you very much, Jerry. I think we have one or two questions for Steve, so I'm bringing him back in. And then, Jerry, can you stop sharing your screen?
Yes. Where's my screen? Hold on one second there, Mark.
I stopped it for you.
Excellent.
And I'm going to just share this contact info slide again while there's RESDC's contact info. And then I'll toggle back and forth between that while I'm asking the questions. Okay. First question for Steve. Steve, can you hear me?
I sure can, yes.
I cannot find a list of dental offices in the booklet covering San Marcos. Are there any offices in San Marcos that are in the plan?
If I could have her phone number, I will call her back after today's Zoom and work with her on getting that choice.
So I'm going to ask the participant that sent me that question if they want to send me a private message to RESDC with that information. I'd be happy to share it with Steve. So if you want to do that, or you can call the RESDC office and we'll connect you with Steve as well at 619-688-9229. Okay, next question. This one's for Jerry. Is the United Healthcare Medicare Advantage available anywhere in California? I live in El Dorado County.
So some of our plans do have limitations, and this is the Medicare plan, or was it the non-Medicare? Is that what?
They did not specify.
Yeah, so some of the plans do have limitations of where you can enroll and where you can't. You have to check with the plan provider based on your zip code, specifically Medicare plans, because Medicare provides, they have limitations on, where you can enroll. So if you live in a zip code that's not within so many miles of a facility, they won't let you enroll in one of our Medicare plans. So we'd have to check individually with the plan provider to find out if your zip code does qualify for coverage in that area.
Okay, let me stop sharing this just to make sure. I might have one more question. All right, thank you to the person who just shared their contact information. Steve, once we get everybody off the meeting, I'm going to have you stay on. I'm going to share their contact information with you.
Absolutely. Thank you.
No problem. Any other questions for the good of the order? Man, we were very efficient today, everybody. Thank you so much for all your cooperation. We're at 10:59. We got it in an hour. You can have an early lunch. But once again, just share this one more time. Check out the RESDC website for more information. Under news and events is where you'll find the YouTube channel. There it is. This recording will be posted there, hopefully in the next day or two. Benefits and discounts, you can find our benefit plans. Just click on that. And then you can actually get to the actual specific detailed information under this link right here. And that'll send you to a website that is hosted by Pacific Group agencies with much more specific details on each one of the plans that is offered. So I encourage you to check that out, www.resdec.net. With that, if there's nothing else, I want to thank everyone again for their attendance. I want to thank our presenters. I want to thank Pacific Group agencies, SDCERA, everyone that has joined us today. You guys had great presentations. And please, to everyone on this call, stay safe, stay healthy. We'll get through this, get through the holidays, and we'll be, hopefully you'll be able to join us at the December 10th RESDC Holiday Fest with more details to follow. Check out the November network hitting your mailboxes next week, and more information to come on that. So once again, thank you everybody, and have a great day. And I'm going to ask everybody to get off, and then I'll talk to Steve by myself if you guys want to leave the meeting. And I'll give you a couple minutes for that, or a minute or two. Thank you, Jerry.